Hi friends, I am Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about what are the causes for the blocked fallopian tubes and what are the treatment options available for that. So friends, don't get panicked. I do get so many clients saying that my tubes are blocked, can I get pregnant, are there any chances of pregnancy or not, or will I be able to conceive or not. So let us go in detail. So basically the causes for the blockage of fallopian tubes could be multiple, but most important is the infection, because in Indian scenario the most commonest is a pelvic inflammatory disease, which includes chlamydial infection, and one of the most commonest infection is tuberculosis and pelvic inflammatory disease. So the most important reason for blocked fallopian tube is the infection. Second most important is major abdominal surgeries. In case of previous abdominal surgeries, because of adhesions also tubes can get blocked. The another important reason is presence of a huge corneal fibroids, because the presence of fibroid at the corneal end can block the fallopian tube as well. And congenital blockage is very rare. In very few patients, 1 in 10,000 we see one case, that's a congenital. And presence of endometriosis. See, in endometriosis as such doesn't lead to tubal block, but endometriosis leads to adhesions. So because of adhesions also tubes can get blocked. So these are the various causes for blocked fallopian tubes. So what are the treatment options? Suppose we see for the treatment of blocked fallopian tubes, we need to clear out the underlying factors. Suppose if the fallopian tube is blocked because of infection, if we treat the infection, automatically tubes can get opened. And in case of previous ectopic also, if they have managed medically, even chances of getting tubal blockage are more. So in those cases also we need to do a HSG with tubal cannulation. We can try just to rule out whether we can open it or not. And then the other thing is we usually plan for laparoscopy and hysteroscopy. So in laparoscopy, first of all we'll see what are the causes for the blocked fallopian tubes. Are there any adhesions? Yeah, definitely release the adhesions. Or is there any source of infection? Then accordingly we need to give the antibiotics. Or if at all, because of endometriosis, if there are a lot of adhesions, then also we need to release the adhesions. And are there any signs and symptoms of tuberculosis on the tubes? Presence of small multiple tubercles, that is suggestive of tuberculosis. So we observe all these things in laparoscopy. And hysteroscopy, we try for the tubal cannulation. So from above we do a laparoscopy, and from down we introduce a camera into the uterine cavity, and through hysteroscopy we'll pass a guide wire and we'll try to open the fallopian tubes. Suppose if there are thin flimsy adhesions, it can be opened, but if the corneal block is thick, so we may not be able to open up even with the cannulation. So at least we can try whether we can open the tubes or not, and there are always 50% chances. So prior to surgery only we usually explain all these things to the patient, and it's left to them whether they want to go for a tubal cannulation or do they have to go for an IVF. They need to take a decision, but at least we can try, and we can try maximum from our side to open the tubes. So these are the treatment options. Suppose if the tubes get open, you can try simple ovulation induction, or else you can go for a smaller procedure like IUI. And still, in spite of all these things, if they doesn't conceive or if the tubes doesn't get opened, then ultimate option will be IVF. So friends, don't get panic. Even if the tubes are blocked, always chances of pregnancy are there. So first we try to open up the fallopian tubes. If it gets open, well and fine. If it doesn't get open, then again the chance of pregnancy is through IVF. So friends, if you like my video, if you find it's informative, please like my video and share with your friends and needy people. Thank you.